yesterday, but that's okay. There's still enough time to get our work done together, and obviously that means that we'll be working some awfully long hours in the next few days. But if he decides to play well with others and doesn't take his ball and go home, we should be able to actually make some good decisions for Minnesotans. These problems really are too huge for him to be going it alone with a little help of some lobbyists whispering in his ear. We need to make sure that this is the actual process that our Constitution calls for. His deciding to do essentially the budget on his own through unallotment would be 10 times the amount that has ever happened in unallotments. You know, there's only been 5 times that governors have unallotted. This would be his 3rd time. Probably bears repeating that this is the 6th shortfall since 2002. The common thread there is the governor was the majority leader at the beginning, and he's been the governor for the last several. It's time to get our fiscal house in order to make sure that our hospitals, our nursing homes, people who are disabled, our seniors and veterans are able to get the services they need. We can't be putting people's lives and our communities at risk. If he plans to cut $1 billion more instead of his borrowing scheme, we're going to see some hospitals closed, we're going to see more jobs lost, and people going without health insurance. You know, the 2 options that basically the governor has given to us is either take my more than faulty scheme that is one-time money that we'd be paying back for a long time and will cost us twice as much. You know, it's one thing when you're buying a bridge that you're going to get to use for 50+ years. It's another issue when you're just balancing the budget. The other choice that he has given us is cutting $1 billion more than his proposals do out of health care and out of police and fire safety. And we just think that's unacceptable. We believe that Minnesotans think that's unacceptable. He isn't offering anything new. It's just more of the same, divisive politics as usual. He's chosen to go it alone and attack the elderly and the disabled. Ironically, he is attacking veterans, even though he continues to tell us that he is doing nothing to cut veterans. So his go it alone ultimatum is not good for our state. It is not the way that we are set up. We are not a dictatorship. We are not a monarchy. He's got several days to come back, and we hope that he does so. We hope to be meeting with him today. We are going to be talking today in LCPFP about what the unallotments could mean for Minnesota and how he would do it. The other thing I'll say, then I'll turn it over to Senator Berglund, is that the kind of education shift he's talking about that clearly we have been more than hesitant to use in the Senate, he could not do it in the traditional way that is a combination of a payment delay and a property shift recognition. He would have to do it all on the payment side. And that would mean going from essentially a 90-10 split to 64%. We would have huge borrowing in many parts of our state, particularly in the metro area and in regional centers that are also having the highest costs that relate to special ed and other needs of our kids. So let's be direct. The governor is proposing a lot of borrowing either at the state level or the local level, and cuts that people really just can't even probably fathom. Senator Berglund.
I just wanted to give folks a little bit of background information about general assistance medical care, since that was the line item veto that the governor chose to make yesterday in the Health and Human Services bill. The program covers people at or below 75% of poverty, or about $650 a month in income. It covers about, in 2011 we expect it would be covering a little over 35,000 people. These are folks that have AIDS, suffer from diabetes, heart conditions, large number of people with mental illness. And the idea that these people, if they don't have general assistance medical care available to them, will just go sign up for Minnesota Care is really a faulty idea. Usually these folks are showing up in crisis in emergency rooms or in needing hospitalizations, and it takes Minnesota Care staff a month to process an application. So, you know, the idea that somebody that's in having a mental health crisis and is showing up in an emergency room is going to make an application and make their premium payment and be processed in time to deal with the health care episode they're facing is just faulty logic. We know that this reduction not only affects individuals who are very low income and in poor health, but it also will affect hospitals and clinics where these folks would be showing up to be served, and there would be no payment for the hospitals and clinics that would be serving these folks. We know also that it will tend to have a detrimental impact on uncompensated care if people are being turned away from clinics, for example, because there is no payment for them, and they end up having a heart attack showing up at the hospital emergency room. We know that will drive up uncompensated care costs.
You know, in contrast, what we've offered back to the governor that he has rejected at this point, and we hope legislators are willing to relook at, is some funding that would help make sure that we don't have to see these kind of drastic cuts. In addition, instead of it being one-time money, we would be starting to put some stability back into our budget. So cutting more than the governor's cut, and perhaps more cuts still need to be made, making sure there's some permanent revenue will make a big difference. If you look at when he's planning on triggering some of these cuts, it would appear that he is trying to push this out to right after he's done being governor. And that's a pretty unfathomable thing. How on earth can a legislator and a governor together make the kind of cuts that he's talking about? We have really done almost an impossible feat this year, bringing people together in both bodies to find ways to make significant cuts because we need to make them, but still have some adequacy in funding. And what we're asking for in the tax proposal that we have is that for people who make over $250,000, just for the portion over $250,000. I'm saying this to you guys because I'm amazed how many people don't understand. It's only for the portion over $250,000 that until we get out of these hard economic times, that they would pay a little bit more. What it amounts to is for someone who is earning $300,000 a year, that they would be paying 29 cents more a day, or $109 more a year. 29 cents, that's the change that is left behind for people on that income. So frankly, if they would do what I think many of us still do, collect their change and throw it in a change jar, we would have the resources that are needed to make a difference so that our hospitals can survive, so that our schools can be in adequate shape till we get out of here. I want to tell you just a couple quick stories about a couple people who has made a difference on general assistance medical care. And I wish I could give you a specific third one right now. Hopefully later today I will be able to, because I keep talking about veterans. I'm a former legal aid attorney. I worked with a number of people who were very low income who utilized this health care program. And many of them are still my constituents. What I see when I go to some of our high rises in St. Cloud is some veterans from Vietnam who do not meet the level of disability to be getting Social Security, but are reliving the war, or perhaps have some mental health issues, related or not, and chemical dependency issues. Some who have physical disability issues, again, not quite rising to that level. They've been able to get by because they're in subsidized housing. They get a whopping $203 a month to help them out in cash, and they have general assistance medical care. If they did not have this care, I'm not really sure what would happen to them. So those are the face of the veterans that get neglected when the governor talks about veterans. The veterans that have been impacted the most by the service. And we should anticipate that we will see that in the future because of Iraq and Afghanistan. But let me tell you two quick stories. One is about Bob, who's a man in his 50s who lives in Isanti County. He has a chronic health condition. It's a form of a degenerative arthritis that requires regular medical care. For For years, Bob was able to manage his health condition because he had a good job with insurance benefits. Then about 5 years ago, Bob's company downsized and he lost his job. Without any income, Bob couldn't afford COBRA and he lost his insurance. Without insurance, Bob stopped getting medical care. After a couple of months, Bob found a new job for less money and with no insurance benefits. He still couldn't go to the doctor. Over time and without regular medical care, his condition worsened. Bob began missing work and was eventually forced to quit his job. Friends told Bob he should apply for disability benefits since it appeared his condition was going to prevent him from working. He tried to apply for disability, but found he didn't have any current medical records to support his application, and the old ones from when he was getting medical care showed a condition under control. He had no idea what to do, he had no money, and was too sick to work and couldn't prove his disability. Then Bob was told about General Assistance medical care. He got some help applying and he was approved. With regular coverage, he was able to get the medical care he needed. He got treatment, medication, and medical support. He started to get better. Because of the years of medical neglect, Bob's condition had deteriorated to the point where he needed surgery. He had knee replacement surgery and recovered well. He is now preparing for a second knee replacement in the other knee. His doctors have told him if he recovers as well from the second surgery as he did from his first, he could be back to work by the end of the year. Without General Assistance medical care, he was basically destined to a life of poverty and despair. He'd been forced to stop visiting his son because he didn't have the gas money to get to his son's mother's for visitation. He was way behind in child support. He was sinking into depression, not to mention the drastic loss of mobility and pain that was a result of his arthritis. He's now optimistic about his future. Both his physical and mental health have improved dramatically. He wants to get back to work and resume a relationship with his son. Bob's lack of medical care not only jeopardized his economic future, but that of his son. This health insurance has made a very different future for him. Second story shorter. Paul is a 20-something guy living in the outer ring of the metro area. He appears to have some level of developmental disability. He is fiercely independent, and he's determined to take care of himself. He doesn't like admitting to any limitations. Currently, he's working on a part-time job for a company that installs swimming pools and other things. He works in a warehouse. He is exposed to a lot of dust, dirt, and things that negatively impact his asthma. In order to maintain his job, he needs to monitor and take care of his asthma. He has an inhaler and other regular medication. Unfortunately, he does not get insurance through his job, and his monthly income is low enough, below 75% of poverty, that he qualifies for GAMC. He was applied and approved for GMC's Transitional Minnesota Care Insurance. Without his insurance, Paul would unlikely to be able to maintain his employment. Now, those are people in the more hopeful scenarios of the people who are utilizing that health care. And the governor has just decided on his own that he will eliminate health coverage for all of them. Questions?
Is there opportunity to override his veto of GAM's, the line item veto?
We do need resources. We need money to pay for it. Do you want to talk about that?
Well, of course, it is a House file, so any override would have to take place in the House first. And I'm not prepared to talk about what they feel they could or could not do.
We do believe that there's a lot of pressure, and there will be more pressure for legislators who may have thought, Republican legislators who may have thought, well, the governor going on his own gets them off the hook. But the bottom line, this is about our communities and our constituents. And so an override is definitely possible, but people have to decide that they care more about the people in their communities than they do partisan politics. The Senate will override if it comes to us. We still believe that the package that we have offered is a reasonable approach. We are, though, willing to compromise, and if there's a different form of fees or something else that the governor is willing to look at, I believe both the House and the Senate would be willing to look at it. The bottom line, though, is we do need some ongoing revenue because this problem is too big to be dealing with one-time solutions.
Senator, is your caucus unequivocally ruling out any sort of borrowing under the confines of what he's laid out?
Again, it's a really bad proposal, and I don't believe the votes are there. There was 2 votes in the House.
Ruling out taking all or part of that proposal?
There's better solutions. There's much better solutions. I don't believe it'll happen.
How about borrowing from the health care access fund?
Well, now that the omnibus bill is signed, I think we only have 45 million. And if that were to be taken, we would be in deficit in 2011.
Perhaps, if you think about the hospitals that have come forward, it's not a good choice, but there's no good choices here, and they've suggested increasing the healthcare access fee. I'll call it a fee. Perhaps there's some other ways to look there if the governor would be willing to make sure that our hospitals can stay open. But again, he's got to show some flexibility there. Just saying no is not a compromise, and it's not a counteroffer. I mean, at this point, what he basically has said, I want to go it alone. And I think Minnesotans should be very concerned that this governor and future governors could just decide the legislature doesn't matter, I'm just going to weigh them out, and then I'll make the decisions myself.
President, could you give us a little more background on the health GAMC, when it was started, and the reasons for starting it, and how it's different from what other states do?
Well, it's been here as long as I have, so I can't really tell you when it got started. A long time ago. There are other states that have programs for people without children that don't qualify for medical assistance, for example. Iowa is one of our neighboring states that most recently implemented a program like it. I think in large part the program has remained intact because everyone recognizes that this population can be very costly if all we're doing is treating them on an emergency basis, and that we do end up paying for those healthcare costs in the end. And so trying to get people in clinics for services, trying to get people who are in crisis stabilized and into a long-term medical home situation really does reduce healthcare costs in the long run. And so I think that's one of the reasons why through good times and bad times we've managed to maintain the program.
Senator Clark, you mentioned that Republicans are going to be feeling pressure. From whom and in what way?
I think that they're already starting to feel, or will be feeling, pressure back home from their hospitals, from people who are working with folks who are disabled and seniors. I think if veterans woke up and understood what the impact on veterans are, they'd start hearing from veterans. They should be hearing from their communities about the loss of police and fire services, particularly smaller communities without the kind of aid that goes to them. It's very hard for them to maintain the officer or two that they have. So I think those are who they should be hearing from. I'm hoping that it won't be like Green Acres, where you had a decision that was made at the end of session and that nobody really understood what the impacts were till months later, and then for the people who that impacted, they were very worked up, understandably worked up, and they came back and insisted on a change, and we changed that. The problem with some of these things is it may take months for people to really understand what the impacts are in their communities. Most people are so focused on their own situations right now that they have no idea what's going on here. And so it may be systems more than people who are going to be saying, look, the governor can't go it alone. He shouldn't be making decisions on his own with lobbyists whispering in his ear, that we really do need to be making sure that we are making decisions together. I know that you guys want to get over to LCPFP too, maybe. So if you have any other questions, I
Can you
just
give
want
us
to
a quick
respect them.
preview of what you see coming up in the next 3-4 days?
Well, the Senate's mostly done its regular work. We don't have much left on general orders, although we will be finishing up those. There's conference committees that are going on. I think that we will be spending, in talking with the Speaker, a fair amount of time in LCPFP trying to figure out what the governor plans to do in a, as a, I guess, change in our form of government. We will be looking at what the impacts further are of the governor's, not just proposals now, but what he intends to do to our communities and Minnesotans. We hope to meet with the governor. He didn't come meet with us yesterday. We did not get to meet with him last night, but we hope to meet with the governor today. It is hard to see, though, where he is willing to compromise when he clearly has told us he's decided he wants to go it alone. So hopefully Minnesotans, people in communities, will actually say something out loud. But there's still time. You know, going back to Representative Simon's analogy, hours are days and days are weeks. So hopefully we can get it done. Because we want, the good news is the governor says, okay, no special session. We think that's a good thing. We just think the budget actually should be balanced in a responsible way.
Do you have any counter proposals to offer?
We keep giving counter proposals. We don't know at this point, that we haven't gotten any counter proposals for him. These are just different versions of no. What cuts? Honestly, a question that I'd like to know is what are the $1 billion additional over his health care cuts? Because the bulk of his cuts are in health care. What is he going to cut on his own? Because he's got a pretty darn big gap. If this is what he's planning to do, what is our state going to look like? Because if he does have a different idea that might be a good one in that, we should look at that. We've got time to pass some legislation. If he's thought of a fair and responsible way to balance this budget, we'd like to hear that. You know, Senator Berglund has spent many years, let alone the last few weeks, trying to figure out how do you still stay down the path of health reform, bring down costs, again in a responsible way, and save money. And I think that she and our conferees, together with the House, have found some ways to do that. It would be great if he'd engage and say, I have some other ideas. Well, what are they? His health care proposals were soundly defeated in the Senate. He hasn't come back with anything else. So we think it's his turn. It's time for him to stop saying no. Thank you. We'll be around.